What new diagnostic methods personalize cystic fibrosis treatment? Imagine a future where treatments are tailored specifically to each person's unique genetic makeup. That's becoming a reality in cystic fibrosis care, thanks to new diagnostic methods that help personalize therapy. These advances focus on understanding the exact genetic mutations and how they affect the cystic fibrosis transmembrane conductance regulator protein, or CFTR, in each individual. By doing so, doctors can choose the most effective treatments, especially CFTR modulators, which are designed to correct or enhance the function of the defective protein. One of the most important tools is genetic testing. It identifies the specific mutations in the CFTR gene responsible for cystic fibrosis. Since different mutations impact the CFTR protein in various ways, knowing the exact mutation helps determine if a patient is eligible for certain targeted therapies. This testing is now standard in newborn screening programs and for diagnosing older patients who were not tested earlier. About 90% of cystic fibrosis patients have mutations that can be matched to specific modulators, making this a vital step in personalizing treatment. Another exciting development involves using patient-derived organoids. These are tiny, simplified versions of organs grown from a patient's own cells, often from the rectum or colon. Researchers can expose these organoids to different CFTR modulators in the lab to see how they respond. If the organoids swell or show improved function, it suggests that the patient might benefit from that particular medication. This functional testing helps predict how well a treatment will work before starting it in real life, making therapy more precise. Sweat chloride testing remains a cornerstone in cystic fibrosis diagnosis and monitoring. It measures the concentration of chloride in sweat, which is high when CFTR is not functioning properly. While it's less specific for personalizing treatment, it still provides valuable information about disease severity and response to therapy over time. Advances in prenatal testing are also shaping personalized care. Non-invasive prenatal tests, like the Billion-Tune Unity Screen, analyze fetal DNA circulating in the mother's blood. These tests can detect a wide range of CFTR mutations early in pregnancy, helping families understand the risk of cystic fibrosis before birth. Early detection opens the door for planning early interventions and considering personalized treatment options after birth. In addition, high-speed video microscopy is emerging as a way to assess ciliary function in the lungs. Since cilia help clear mucus, their movement can be impaired in cystic fibrosis. By analyzing ciliary motion with advanced video techniques, doctors can gain functional insights that may influence treatment strategies, especially in complex cases where standard tests don't provide enough information. Research continues to explore new biomarkers that reflected the health of multiple organs affected by cystic fibrosis. These include assessments of the microbiomes in the lungs and gut, epithelial cell health, and overall metabolism. Such biomarkers could help clinicians understand each patient's unique disease signature and tailor treatments beyond just the lungs and sweat glands. In clinical practice, these diagnostic methods are combined with a patient's medical history, symptoms, and physical findings. This comprehensive approach allows healthcare providers to craft personalized treatment plans that maximize benefits and minimize side effects. The ability to match therapies to specific genetic and functional profiles marks a major step forward in cystic fibrosis care. Ultimately, the future of personalized cystic fibrosis treatment depends on integrating detailed genetic and functional diagnostics. This approach aims to optimize therapy choices, improve quality of life, and enhance long-term outcomes. But it's always essential for patients to work closely with healthcare professionals experienced in cystic fibrosis to ensure that treatment decisions are safe, effective, and tailored to their individual needs.